Hello everyone, and welcome to our channel. Today, we're sharing a story that's incredibly moving and full of hope. It's about a young couple, both just 26 years old, who faced what seemed like insurmountable odds on their journey to parenthood. She was diagnosed with severe polycystic ovarian disease, or PCOD, a condition that can make getting pregnant very difficult. His diagnosis was even more challenging. Azoospermia, which means there were no sperms found in his semen analysis. Can you imagine receiving that news? Two significant hurdles, one for each of them. It's a situation that would test any couple's strength and resolve. They came to us, understandably worried and uncertain about their future. Could they ever have a child of their own? This is the story of how, against all odds, they did. Let's break down their medical situation. For her, severe PCOD meant her ovulation was irregular, a common but frustrating problem for many women trying to conceive. Her cycles were all over the place, making it nearly impossible to predict the right time to try for a baby. For him, azoospermia was a huge shock. When the lab report came back with 0 sperm count, it felt like a dead end. Many couples in this situation might think their only options are using donor sperm or adoption. While those are wonderful ways to build a family, this couple held on to the hope of having a biological child. So, our first step was to figure out why. Why was there no sperm? Was his body not producing any at all? Or was there a blockage preventing it from getting out? This distinction is crucial, and it was our starting point. To find the answer, we needed to look deeper. We conducted a series of tests for him, including hormonal blood tests and a scrotal ultrasound. The hormone tests help us understand if the brain is sending the right signals to the testes to produce sperm. The ultrasound gives us a clear picture of the testes and the surrounding structures, checking for any blockages or abnormalities. In his case, the hormone levels and the size of his testes were all within the normal range. This was a very positive sign. It suggested that his body was likely producing sperm, but it was just not making its way into the ejaculate. This is known as obstructive azoospermia. It gave us a new direction and a renewed sense of hope. The problem wasn't production, it was transportation. With this new information, we could create a clear plan. The goal was to retrieve the sperm directly from the source, his testes. The procedure we recommended is called testicular sperm aspiration, or TISA. It is a minimally invasive procedure where a fine needle is used to draw out a small amount of tissue and fluid from the testes. We were confident that we would find sperm this way. For her, we needed to prepare her body for pregnancy. Since her PCOD made natural ovulation unreliable, we planned for in vitro fertilization, or IVF. This involves stimulating her ovaries to produce multiple mature eggs, which we would then retrieve. The plan was set. Retrieve his sperm via TESA and her eggs via standard egg retrieval procedure, and then fertilize the eggs in the lab. On the day of the procedure, there was a lot of anticipation. The TESA procedure for him went smoothly. And just as we had hoped, when our embryologist looked at the sample under the microscope, it was full of healthy motile sperm. You can't imagine the relief and joy in that moment. It was the breakthrough we were all waiting for. Simultaneously, we had successfully retrieved 15 mature eggs from her. This was an excellent number and gave us a great chance of success. Now, it was up to the science in the lab. We used a technique called intracytoplasmic sperm injection, or ICSI. This is where a single healthy sperm is carefully selected and injected directly into each egg. It's a very precise method that is perfect for cases like this, where sperm is retrieved surgically. The next few days were a waiting game as we watched the embryos develop in the lab. Out of the 15 eggs we fertilized, an amazing 10 developed into good quality blastocysts. A blastocyst is an embryo that has been growing for about 5 days and is at the right stage for implantation. Having 10 high-quality blastocysts was a fantastic outcome. It meant we not only had a great chance for this cycle but also had frozen embryos for the future, if they decided to grow their family further. We chose the best-looking embryo and transferred it into her uterus. Then came the most anxious part of the entire process, the 2-week wait to see if the embryo would implant and result in a pregnancy. For the couple, these 2 weeks felt like an eternity. After what felt like the longest 2 weeks of their lives, it was time for the pregnancy test. The result was positive. They were pregnant. The joy and relief they felt were overwhelming. But we remained cautiously optimistic, as the early weeks of pregnancy are critical. We monitored her closely with blood tests and ultrasounds. Seeing the tiny flicker of a heartbeat on a screen for the first time was an emotional moment for everyone. It was the confirmation that their dream was finally coming true. The pregnancy progressed beautifully, without any major complications. All the struggles, the tests, the procedures, it was all worth it. 9 months later, the couple welcomed a beautiful, healthy baby into the world. Holding their child in their arms was a moment of pure bliss, the culmination of a journey filled with incredible challenges and unwavering hope. From a diagnosis of zero sperm and severe PCOD to a healthy baby, their story is a powerful testament to the advancements in reproductive medicine and, more importantly, to the power of perseverance. It shows that even when the past seems impossible, there can be a way forward. Their journey from despair to pure joy is why we do what we do. It's about making the impossible possible. This couple's story is a beacon of hope for so many others facing similar infertility challenges. Azoospermia doesn't always mean the end of the road for biological parenthood. With the right diagnosis and advanced procedures like TESA and ICSI, many men can still father their own children. And for women with severe PCOD, IVF offers a highly effective path to pregnancy. The key is not to lose hope and to seek expert medical advice. Every case is unique, and a personalized treatment plan can make all the difference. If you or someone you know is struggling with infertility, please know that there are options available. Don't be afraid to ask questions and explore them. We are so grateful to this couple for allowing us to share their incredible story. It is a privilege to be a part of such a life-changing journey. Their strength and trust in the process were truly inspiring. We hope their story brings comfort and encouragement to anyone out there who might be feeling hopeless. Miracles happen every day in our field, and they are built on a foundation of science, expertise, and a little bit of faith. Thank you so much for watching and for letting us share this beautiful story of hope and happiness with you. If you found this story inspiring, please give this video a thumbs up and subscribe to our channel for more content. We'll see you in the next video.